Hello, and welcome to this episode of Let's Talk Death. I'm Kiri Meyer.
And I'm Andy McNeil.
And we are thrilled to be your host for these conversations. Let's Talk Death is brought to you by Heal Grief, a social support network creating a community after someone has died. Everything we do is inspired by our core belief that no one should ever need to grieve alone.
Our goal with this program is to have a friendly chat with some amazing people in this field. We can help normalize and educate our Heal Grief community. We're pleased to have David Forstadt to our show. David is a doctoral candidate in clinical psychology and holds 2 master's degrees in community mental health counseling and psychology. He has 15 years experience in the field of behavioral health, specializing in addiction, dual diagnosis populations, and mental health administration. As an expert on program development, integrated care, and research-based approaches, David has helped provide services to many in the behavioral health field nationwide.
So welcome, David. We are so glad to have you with us today.
Thank you for having me. I really appreciate it.
Oh, of course. Well, I say that we just jump right into the good stuff here. And we talk about the relationship that you've seen in your work that addiction may have with an individual's grief journey. So would you be willing to speak more about how you see kind of these 2 topics intertwining?
Yeah, sure. For myself and the work that I do with my clients, grief can be quite a convoluted concept, and it can encompass a wide range of things from, the traditional loss of a loved one all the way to the loss of someone's drug of choice. And within that, as much as they're separate entities, they all play like an integral role together as being a risk factor, a resilient factor, and depending on the approach that you take clinically, it will determine, where someone's at with it in the future.
Interesting. So when we're talking about, not only a death loss, but also these other losses, I think that's something that's really interesting to focus on because in our world, I don't know if we necessarily see them as losses, but I think maybe we should. What are your thoughts on that?
Definitely. That's an interesting way of looking at it, and I agree. I think there's a parallel between even the way we perceive grief and even trauma-related disorders. Most people conceptualize trauma as a physical or emotional or a sexual abuse, but trauma encompasses divorce, rapid and sudden change to one's ability to understand and process conceptual types of things outside of their developmental stage. I know for you being a child therapist, that's a huge indicator in one's ability to move through the lifespan in a healthy way. I perceive grief similarly where, as I said, it encompasses the loss of a loved one. It encompasses the loss of a life that you thought you were going to have. It encompasses the loss of a drug of choice. And I think based off of core fundamentals a person possesses and the way in which they understand and conceptualize that actual event will determine, their success in the future. So I know from an addiction standpoint, grief and trauma are obviously interrelated. An individual who loses a loved one at a very early age often lacks the resources to be able to cope effectively. And as a result, they move to more of a maladaptive learning style when trying to manage the emotionality of the situation. And sometimes desperate times call for desperate measures. And when we lack out of something ourselves the emotional intelligence to understand and comprehend what that death feels like, what do we do with those emotions, and what we can expect from that cyclic process. And not to kind of segue too often to left field, but there's a lot of preconceived assumptions and notions about death and the grieving process. And I think that interplays in antagonizing the addiction cycle. So you have these kind of maladaptive cycles interweaving with one another. And you would think that 2 wheels turning would make the car move, but you're kind of just spinning around in a circle of insanity.
Right. It depends on what direction.
Yes.
What direction the wheels are turning, right?
Exactly.
When it comes to it. What I also find interesting, and obviously the title of our show, Let's Talk Death, it's this idea of how addiction, also grief, loss, and really any number of losses in our life point to the kind of the finite nature of life,
Yes.
in and of itself. And so there's this existential sort of issue of wrestling with our own humanity,
Yes.
our own finiteness. So if that's even a word.
Mm-hmm.
And so I find that interesting. The idea of, number one, people who are dealing with addiction, who quite often have interacted with or made friends with, or even if they've been to rehab, a number of people who maybe they themselves, their life has ended early as a result of perhaps their or how their addiction has impacted the quality of their life and this desire to get that quality of life back. To me, those are all issues of just as much death as they are issues of life.
Yes.
Really what we end up talking about on the show, Let's Talk Death, we end up talking about the life because it reminds us of the importance of obviously the choices we make in life, but also those choices aren't made in a vacuum, right?
Yes.
All these issues and things that we carry with us from our own life, our own childhood, and maybe even maybe choices we didn't make.
Exactly.
Happened to us, right?
Yeah, because it comes down to like the loss of perceived opportunity, the loss of perceived positive perception from loved ones. I think there's absolute and concrete thinking that antagonizes the loss process as one navigates the early recovery world, because there's these preconceived assumptions that all these doors have closed. I can't enter them again. And as a result, my perceived ability to have options in the future are significantly limited. And that not only will antagonize one's sense of self significantly, which is tends to perpetuate, the addictive process, but it also antagonizes the interrelationships of those around them, because everyone is setting expectations and assumptions about how everyone should be within this process. And that is so specific to the grieving process, even from the loss of a loved one, of you should be better by now, you should be over it, or I was closer with this person than that person, why are you sadder than I am? And there's again an interesting parallel process within the recovery of substance use and even mental health that mimic grief so much.
Well, and it sounds like even stigma. It sounds like even stigma, like certain stigmas that stay with each of these types of issues, right, that people have to overcome as well. And it also reminded me of a term that we use quite often, at least in the grief field or death and dying field, is the idea of shattered assumptions. So there's assumptions that people make on you. And there are also, because of these experiences in my life or things that have happened, there's these assumptions I had about my own life that have been shattered as a result of whether it's the addiction or the losses that I've had. It's part of that.
Yeah, very much. And it reminds me of, and you've brought up humanistic approaches to processing this information, and I always revert back to Viktor Frankl and Man's Search for Meaning, which is a beautiful book about coping with complex grief and loss from one who is a clinician actively involved in that process and getting insight. So I always reflect on the term existential guilt, which I think definitely deals with the loss of a loved one and the loss of being in a circumstance where we didn't live up to our perceived potential in a situation. I mean, and even when we lose a loved one, there's always a question of, I wasn't there for them. I didn't say what I wanted to say. Maybe if I was better to them in life, then we would have had a better relationship. And the shoulda, coulda, wouldas can be quite toxic.
And I think it's hard with kind of, as we've been talking about, the societal stereotypes that we have. And I think there's a slow movement, unfortunately it's rather slow, of realizing that addiction is, there's a disease around it. It's not like, oh, you've made this horrible choice and things like that. But I'm wondering how the grief will catch up to that as well. Kind of that change of, this is not, I don't know. I'm hoping that there's this societal shift where the issues, the complex grief that we're talking about for the individual, but also for the people in their lives, I'm hoping that will become a little less stigmatized too, because I know that, especially I work with young adults as well, right? Grieving young adults. And I hear so many of them say they died of an overdose or, some other kind of addiction related issue. And they say, but I don't talk about that part of it with other people. And that, I think that's a little worrisome too, is it not?
No, very much so. I do think that those struggling with both mental health and addiction are silently struggling. And we often, again, compartmentalize significant and pervasive mental illness with less severe, even in our own clinical community, of, they just have depression and anxiety versus they have schizophrenia. And in many respects, we feel like we can't really voice the level of impairment and distress that comes along with chronic and pervasive depression and anxiety. And as I alluded to earlier, desperate times call for desperate measures. And when we lack the skill set to cope effectively, especially at a young age, and we use to manage our emotions, we not only prevent our ability to go through the motions of learning, the trial and error of experiencing a negative or an aversive situation and practice till you kind of get it right. And then there's this horrible trickle-down effect where you spend so many of your prime developmental years masking your emotional experience. When you try to get clean at 25, 30 years old, you're experiencing a lot of the emotional roller coasters of what a 14 or 15-year-old would go through. And there's a stigma around that. There's a stigma of, emotionally kind of castrating yourself. I know that sounds like an extreme term, where many feel like they don't have the ability to bounce back from that. And then with the societal stigma on top of it, it just feels like your candle's burning from both ends. You don't feel like you have the autonomy to make the appropriate changes. And then society is now telling you, you don't have the skill set to make the appropriate changes.
Yeah. And in that feeling, a real lack of just support yourself on top of all those things. There's another concept, and as you were talking, it made me think about a term that Ken Doka coined called disenfranchised grief. And I know that probably in addiction services, you probably encounter a number of not just people with disenfranchised grief, but really just disenfranchised communities.
Yes.
For whatever reason, haven't been seen as either legitimate or even when there is grief or a loss, that's not considered legitimate. And how that then perpetuates a person's sense of kind of their outlook of their own life. And of course, using substances as a way to cope with being disenfranchised.
Exactly, 100%. And one of the things that Jade Recovery likes to do is focus on minority groups who have been disenfranchised and have to grieve the loss within their own experience or from a generational trauma of losing the opportunity to be at the same playing field as the majority group of individuals within our society. So, LGBTQ, the African American community, the transgendered community, veterans and first responders, these are all groups and demographics of individuals who are really silently struggling because their struggles often minimized because people perceive their own subjective experience as worse or harder. For example, a gay man might be told, well, you chose to be gay, you chose to live this lifestyle. So if your family leaves you, that's a consequence of your own actions versus the loss of a loved one through death where they didn't have control, possibly over that occurring. And as a result, that's worse.
Yeah.
And the interesting aspect to that too is you're not only getting that disenfranchised grief, but then you have all of this other shame and blame and all of these other pressures added on top of it, which again only complicates not just your grief, but just your whole overall experience.
Mm-hmm.
So I'm thinking this is something that we don't normally talk about.
Mm-hmm.
But what would happen in your eyes, kind of dealing with what you do, what would happen if we acknowledge this as a grief process, whether it was a death loss or not?
Mm-hmm.
What changes might you see in somebody if you allowed them to actually grieve, whether it was a drug of choice, whether it was a family pulling away, whatever that looks like? Would that change some things in your eyes?
Yeah, I definitely think so. In many respects, the way that we define ourselves, as I said, turns into part of our self-concept, which we as a society and as a self-thought feel like we have control over, we should have control over. By removing the stigma that you're dealing with something that might be perceived as a negative part of your integrity or your value system, it allows individuals to be more receptive to processing it without the filter of negative self-talk. Because oftentimes that negative self-talk is then related to our irrational belief systems and these life traps that perpetuate falling back into these routines and cycles. And oftentimes, especially substance abuse, is just this cyclic pattern of negative thought processes, which then are addressed with inappropriate emotional responses, meaning the emotions that are used to process a situation aren't productive to that person's needs. And then use occurs again, and then the cycle goes on and on again. So I think, getting to your point, allowing an individual to stop catastrophizing the experience as a result of their negative sense of self opens up a plethora of different ways of processing an event, especially death.
So, David, we only have a few minutes left. We do want to give you an opportunity to share a little bit, if someone was interested in learning more about Jade Recovery, what you're doing with that, the work that you're doing,
Yeah.
be able to connect up with you all. How might they go about doing that?
Yeah, definitely. So Jade Recovery is a dual diagnosis mental health and substance abuse outpatient clinic located in Denver, Colorado. If someone is interested in offering or coming to get services, they can go to our website, www.jaderecovery.com. There they can learn about all of our admissions protocol and all of the unique and innovative services that we offer to really meet a person where they're at in the recovery process.
Right.
Great. Well, David, we just want to thank you once again for being here as our guest on Let's Talk Death. And we just really love being able to kind of broaden our talks, and really kind of bring some other ideas in. So we really appreciate your point of views.
No, thank you. I appreciate you allowing me to come on, and I think we had a great talk.
Thanks, David.
Thank you.
Those of you who are tuning into this episode, if you would like to learn more about Heal Grief, please visit healgrief.org. You can also learn more about Heal Grief's program, Actively Moving Forward, which is for young adults who are grieving, by visiting the website as well, healgrief.org.
Let's Talk Death episodes will air monthly, so make sure to sign up on healgrief.org to receive our newsletter for a link to next month's episode.
And thank you for joining us. We will see you next time on Let's Talk.